Good morning, Dan and Amy. We welcome the Atlantic to the party of actually asking questions about COVID policies. Annie Lowry writing in the Atlantic, and we spent a lot of time talking about young people, kids in school, young younger people, people in the workforce, people of working age, whether they're on the employee side or the employer side, and the policies related there. Well, what about protecting those that we know, or the evidence being overwhelming, the exponential difference in mortality rates between the young and the old? So what about protecting the old? That's what Annie Lowry writes about in the Atlantic. As the country plunged into a deep and unusual economic recession last year, it also plunged into a deep and unusual social recession. Social recession, atomizing families and friends, evaporating hours, laughter and care and touch. This phenomenon hit nobody as hard as America's seniors, who are much more likely than their younger counterparts to live in care facilities, many of whom have struggled to connect in a socially distanced or virtual fashion. She talks about how, per a study, how much the presence of human contact has declined among seniors in these facilities, this being particularly important. Survey conducted by Alterum, a nonprofit healthcare research and consulting group, finds just 5% of residents in care facilities said they had visitors 3 times a week, compared with more than 50% before the virus hit. Nearly all said they did not leave their care facility for a meal or go shopping, compared with 40% before COVID. Only 1 in 4 was going outside for fresh air. Half said they no longer had access to activities such as art classes or group exercise. Nearly 90% said they could no longer eat meals in the dining room. 2 in 3, 2/3, said they no longer left their rooms to socialize with their peers.
So they're dying of loneliness.
A professor of healthcare policy at Harvard Medical School. When we look back on this in the years to come, I imagine there's going to be a lot of Monday morning quarterbacking around whether it was a good idea to blockade older adults in their nursing home rooms for 8, 9, 10 months out of the year without letting them have access to their families. I think we're going to look back and say, what the hell were we doing? What we were doing was failing to save seniors' lives or maintain their livelihoods. Well, that's quite an indictment, isn't it? And by the way, some of us have been asking, what the hell are we doing from the outset across a range of COVID-related policies? And we will continue to, which leads us to our next guest. Pleased to be joined by Dr. Eric Feigl-Ding, who's an award-winning Harvard-trained epidemiologist and public health scientist. Dr. Feigl-Ding, thanks so much for joining us. Appreciate it.
Yeah, thanks. Hope everyone's well.
What about what Dr. Grabowski from Harvard Medical said about policies related to isolating seniors?
Yeah, I think that we've really ignored a lot of the welfare of seniors. I agree there's a lot of loneliness. There's a lot of these other issues besides the pandemic that we have to look into, because our healthcare system is just so neglected in so many different ways. And our mental health care is actually one of the worst mental health care systems in the entire world. So I think there will be a lot of things we have to look back on of, we really screwed up in so many different ways for our seniors, for our children, how we basically prioritize bars and before schools, and now have hurt our next generation for decades to come.
And we here in Cook County, we've had 16 suicides, but 5 COVID deaths. And those COVID deaths, all 5 of them had severe comorbidities. How can we convince our politicians? What do you think we could do to convince them to reopen our schools, to make it mandatory?
So I think schools are really important. And of all the things to close, I think schools should be the last to close. But at the same time, we can't just reopen, willy-nilly, because schools are a infectious location. And we know that from studies. But I think to reopen, there are ways. We need really good upgrades in our air quality in our schools. We need HEPA filters in every classroom.
Got that now, yeah.
I know it's very tricky in terms of affordability on that. We need state and federal assistance for that. We need ventilations. We need a lot of different things in addition to just simply wear a mask and have some distance, because that's technically not enough in a lot of crowded rooms with poor ventilation. And I feel like we're completely ignoring this aspect of, yes, schools should need to open as much as we can, and we can sometimes give a little leeway for schools, but at the same time, we're not doing what we need to. And the new virus strain, the B117 variant, is so much more infectious that we've lost almost any wiggle room we had previously to keep schools open. And so this is why we're in a really world of hurt right now.
Well, I want to get to the mutation in a second, but with respect to schools, there's a November 2020 study that was published in JAMA, Journal of American Medical Association, that's findings were thus. The analytical model found missed instruction during 2020 could be associated with an estimated 5.53 million years of lost life. This loss in life expectancy was likely to be greater than would have been observed if leaving primary schools open had led to an expansion of the first wave pandemic, meaning these findings suggest that the decision to close U.S. public primary schools in the early months of 2020 may be associated with a decrease in life expectancy for U.S. children. So that study seems to suggest actually the schools should have never been closed in the first place, and they shouldn't be closed now. And yeah, if you want to upgrade in real time as we go on and we learn things, well, that's all well and good. But the net position is schools should stay open, and they should have stayed open from the outset.
Yeah, and so there have been many studies on schools, and that is just one of the studies. There's, I would say, a dozen other studies on the infectious and transmissions during school. Schools, we do know, add anywhere from 0.12 to 0.2 to 0.3 in the R value, which is quite significant in many ways. It's now the issue is primary schools. I think primary schools, the common virus and the one especially in the spring was shown that kids are less susceptible. In the primary school, kids are less susceptible than adults. But that's not true for teenagers. But the problem is with the new variant, which we know we'll talk more, is that may no longer be the case anymore. But that said, kids do transmit the virus more. They're less susceptible if you expose, but they do transmit it more and transmit it faster because of their exposure and transmission. There's three different things.
To transmit it, transmit it more where, in what circumstance, in what environment?
So for a virus, there's three aspects. There is how easily someone transmits it, gives it to someone else, how easily someone gets it if you're exposed, and how much exposure someone has. For example, a kid running around in school has a lot of exposure, while someone in a nursing home does not have much exposure. So there's these three dimensions, and kids are less susceptible, true, especially the younger kids. Teenagers, not so. The young kids are less susceptible, but they're more they have more transmission, and we know that they bring it to families, and they're the most common.
Well, do we know that? I mean, again, yeah. I know there's competing studies all over the place, but
this came from the UK SAGE group. The kids are anywhere from 2 to 7 times more likely to be the first to have it in a family. They're basically they're also transmitting it more, 2x more transmission. That said, if you give it to them, they're about half as likely to get it. But
but in terms of them being facilitators of transmission, how do you explain the Yale research study that surveyed 57,000 child care providers across all 50 states in this country last year, and found that there was no difference between the spread in those childcare facilities that stayed open versus those that did not among children to adults. So how do you explain that?
Childcare facilities are usually daycares, right? And they're the extremely young kids. And again, what I'm saying is that in the spring, it was the strain that we had in the spring is also much less infectious than we have today, and much less infectious than the new variant. We're on the 2.0 variant, technically. The common one that's currently around is the 2.0 version. And
is there enough data?
Very different.
Is there enough data on these new mutations to make those sort of conclusions about transmissibility?
Yeah. So the numbers I said about 2x actually comes from the UK's official. It's the equivalent of their CDC recommendations. SAGE is the leading UK scientific public health body on this coronavirus. It's like the coronavirus task force. So this is the leading body of the UK government that said this.
And do we know anything about the lethality of that mutation? Do we know anything about the incidence?
The new mutation, the new mutation is not more lethal, but it's more infectious. But in certain ways, that's actually worse, because a virus that's more infectious will actually infect more and actually increase the total pool of people from which people get sick, right?
Well,
and in certain ways, that's actually worse than the virus that's more lethal but not less infectious, because that's a virus that slows down and ends quicker.
Well, can this London variant be stopped with the vaccine that we're using right now?
So the B117 variant from the UK can. We believe it can.
Okay. Well, that's good news.
We don't think it has vaccine escape potential. But the new South Africa variant, that one is actually much harder to say, because we've actually seen vaccine escape anywhere from 3 to 5% for some of the mutations in that one, in some of the preliminary studies on how they basically escape antibodies from people who recovered. So that's the problem. Like, the new infectious one is not escaping the vaccine, but the South African one might be, but that one is less circulating. So there's two really bad ones circulating right now. And this is why it's so hard for people to keep up with it, because research that happened in this early spring may not apply anymore, because the infectiousness of the new virus is completely different. And some people say that the new B117 strain from the UK is actually infects kids more than the previous strain. And that's the real concern. We lost all the wiggle room that we previously had.
But do we know that for sure?
We are pretty confident. So this new virus for sure is more infectious. Now, so that increases infectiousness in everyone. Now, the issue is it like increasing across the board, or is it increasing across the board, but especially in children? Right now, that's the only remaining debate. We know for sure that the new virus adds anywhere from 40 to 80% to the infectiousness, adds basically an R of 0.3 to 0.7, which is really, really high. Remember, you have to keep R under 1. And basically, if any wiggle room under 1 has now been almost completely taken up and eaten up by the new infectiousness of the new strain. This is why people are really in a panic, and the UK groups are saying that they've lost control of the pandemic. And Denmark CDC, one of the leading SSI CDCs of the world, they said, if we don't control it now, including closing schools, we may not be able to control it at all in February and March, when the new virus has dominated the world. That's their real concern. And so my point is, previously we could have a little wiggle room to keep schools open by giving, closing other things, but keeping schools open and still staying under 1. R under 1 will basically mean that we have it contained. But we've lost that potential now because of the new infectiousness. And that's a grave concern that every scientist and government leader now has.
He is Dr. Eric Feigl-Ding.